Welcome back to Your View.
Thanks for staying with us. So, BC had a question?
Okay, yeah, I want to ask, how do you really know that this child has leukemia? What are the symptoms that you see? And what do you advise? Because when your child is sick and you take the child to the hospital, most people do not wait to see a pediatrician. Most hospitals don't even have the services of a pediatrician. So do you encourage parents to make sure that a child sees the specialist for any time
It doesn't always, let's get things in perspective. It doesn't always work out that way. You know, the child may be ill, like you said, malaria. So what if it's severe malaria? But what if it is not? So you should, the onus lies on the physician seeing, of course they will refer once they know it's going out of hand. Now, like you said, leukemia is a clonal disorder. That means it's crowding the bone marrow. These are abnormal, you know, white cells and all. So that means the normal function of the bone marrow is depressed. You're talking about anemia and everything. It's not just anemia, there are other things. You can imagine if you have like 3-4 different components that are supposed to work in the bone marrow, and then you just have one that is overcrowding every other thing. So yes, anemia. Patient comes out with anemia because the bone marrow is crowded. That's a symptom. Another thing is infections. Okay, so that malaria you're talking about, because the child had fever, it's called neutropenic fever. Okay, it's not because of, you know, the patient is just immunocompromised. Okay, another thing is crowding the bone marrow. You have low platelets. You're talking about a mark when we were off screen. Okay, so that means he was bleeding under his skin and everything. So parents, if you notice any of these things, your child is slow, he's not as active, he's having fever that is not going down with malaria, anti-malarials or with antibiotics, and then he's having this like bleeding. So you should check the skin of your children.
How is the mark?
We're just saying, it could be anywhere. It could be at your back, on your bottom. It could be anywhere. Like a blood skin, like if you fall.
Oh, yeah, like
like a bruise.
Oh, I get.
Yes.
But the doctors told Temi's mother that once you see the mark, then he's okay.
That means well.
That
There
means
was a
he's
mark.
Okay,
One of his finger that is well, and the mark actually appeared there.
All right, let's go to the issue of the foundation. What exactly is the objective of your foundation?
Okay, thank you very much. The objective of the foundation is to create awareness, tell the whole world what leukemia is all about, that we should stop believing about the someone that is doing the child. When the child is sick, take the child to the hospital to create awareness and to also put a smile in the face of children in the hospital. I was once in it, and I know what it takes to be in the hospital for mothers. At times you ask a mother to buy a syringe, she couldn't have the money, not to talk of getting blood. And a leukemia child needed blood. Often, the doctor will always tell you, as often as you can get the blood, we need it. So there are people at the blood bank, hang there. They are ready to sell it for you. When I started, I don't even know they get it for 8,000. I was paying 10,000 to get a pint of blood. Then a child needs platelets, in terms of platelets, because if the platelet is not in charge of the body, the child can bleed from anywhere. So the platelets, you can get like 4, 5 in a day. And platelet is taken from the blood. It's extracted from the blood.
Platelet is that part of the blood that helps your body clot if you have an injury. So in leukemia, they don't necessarily have an injury, they just bleed.
Yes.
So you need
to bleed from the mouth, any part of the body,
any part of the brain. It could go unconscious.
Because the blood is not clotting, right?
Yeah.
Okay, I have a few tweets. Maybe we can answer their questions. Adekola says, leukemia is curable. We just need to change our diet and the way we live. God created our bodies to heal itself, but we have to use corresponding natural God-made herbs and natural foods, not idled foods, to address it. I'd like you to address that. Omogbala also says, again, the problem here is about leadership deficit. Leaders over the years have no political will to revamp the health sector, largely because they can afford to get adequate health care outside the shores of Nigeria, sadly, most often with taxpayers' money. So 2 issues now. Is leukemia curable if we eat natural rather than inorganic?
I think the word he's trying to say is preventable.
Okay.
Because when that mutation starts, when the process starts, that's